Anxiety disorder are the most common mental illness in the US, affecting 40 million adults in the United States age 18 and older, or 18.1% of the population every year. Anxiety disorders are highly treatable, yet only 36.9% of those suffering receive treatment. Anxiety is not just a feeling of nervousness. Anxiety comes in many different forms, such as panic attacks, phobia, and social anxiety. Anxiety can be normal in stressful situations. However, it can become a disease when feeling becomes excessive, all-consuming, and interfere with daily living. Your hands are starting to sweat, your body is shaking, your heart is beating out of your chest, your mind can't seem to think straight. The control you just had over your body and feelings has vanished and nothing seems bearable anymore. You breathe in and out, but all you feel is stress, worry, and fear. Some of you might be thinking that this describes how you feel on a stressful school day or how you feel speaking in front of a class. That is completely normal. Anxiety is a normal part of life and is an important psychological phenomenon which influences everyone's life. But when it interferes with daily living and consumes your life, it becomes a disorder. A person with anxiety may sweat, feel restless and tense, and have a rapid heartbeat. Extreme anxiety that happens often over time may be a sign of an anxiety disorder. Anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. They cause people to avoid situations and isolate themselves when no immediate danger is present. They interfere with daily life, for example, school, work, and relationships. Anxiety disorders can cause poor body image and low self-esteem. It can cause intense emotional reactions, anxiety, and impulsive patterns of behavior. Lack of concentration, racing thoughts, unwanted thoughts, fatigue or sweating, excessive worry, fear, feeling of impending doom, insomnia, nausea, palpitations, or trembling. Now that I've discussed what anxiety is as well as the symptoms, I will now discuss the types of anxiety. First, general anxiety disorder or GAD. People with this disorder display excessive anxiety or worry, most days for at least 6 months, about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The second one is panic disorder. People with panic disorder have recurrent unexpected panic attacks. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by a trigger, such as feared object or situation. The third one is phobia. A phobia is an intense fear of, aversion to, specific objects or situations. The best example of phobia is social anxiety disorder. Social anxiety disorder have a general intense fear of or anxiety toward or social perform situations. First, they worry that actions or behaviors associated with their anxiety will negatively evaluated by others, leading them to feel embarrassed. 2. This worry often causes people with social anxiety to avoid social situations. The fourth type of anxiety disorder is obsessive compulsive disorder or OCD. People have recurring, unwanted thoughts, ideas, or sensations that make them feel driven to do something repetitively. The fifth one is post-traumatic stress disorder or PTSD, a most well-known trauma and stress-related disorder in which a person has difficulty recovering after experiencing or witnessing a terrifying event. For example, someone who has been in the army, car accident, and a death of a loved one. Now that we have learned about the various forms of anxiety, I will now discuss the treatments and preventions for anxiety. First, cognitive behavioral therapy or CBT teaches people different ways of thinking, behaving, and reacting to anxiety, producing and fearful objects and situations. Second is dialectical behavioral therapy or DBT, uses a skill-based approach to help patients regulate their emotions. The third one is medications, antidepressants, anti-anxiety medications, and beta blockers. There is a treatment, there is also a prevention. First, stay active. Participate in activities that you enjoy and make you feel good about yourself. Enjoy social interaction and caring relationships which can lessen your worries. Second, Avoid alcohol or drug use. Alcohol and drug use can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you feel anxious. The third one is meditation and yoga. Mindfulness, meditation, and yoga can increase one's awareness of the world around you and increase your control over how you experience situation and how you respond. The fourth one is exercise, healthy diet, and rest. Exercise has been shown to decrease stress hormones that influence anxiety and also improve overall mood. It seems counterintuitive that you can eat your way to calm, but sustaining a healthy diet can really help you to feel more at ease on a regular basis despite stressors. Not getting enough restful sleep can trigger anxiety. Stress and anxiety can also interfere with sleep and cause you stay awake at night.